This week on the BackTable podcast.
I specifically chose men's health because I knew I would be in the minority, and I only saw that as a positive. Some people, I guess, may see it as a negative, but it helps you stand out. So also coming into a field, think of it that way, like you will stand out for better or worse. They will need a female on a panel somewhere, and that will be you, and that's okay. If that's your first time getting on that panel, I'm okay with that, right? So I think you have to kind of look at it glass half full where you can, and then relying on those mentors, right? And they don't have to be female mentors, right? Some of the best mentors may not be same gender, and they can give you a lot of insight into like what is success in this field. How do you get there? What do you want out of your career?
Hello, everyone, and welcome back to the BackTable podcast. I'm your host, Dr. Helen from Indiana University. Welcome to this BackTable SWIU episode, where I'm very excited to introduce our guest today, two phenomenal physicians and good friends of mine, Dr. Sevann Helo from Mayo Clinic, Department of Urology, and Dr. Simhan from Temple University Hospital, Department of Urology. How's it going, guys?
Hey, how are you? Great.
Great. We're super excited to be here.
I am thrilled to have both of you join us for today's episode. So if you're a resident who's thinking about the next steps in your career, or even an attending who just wants to better understand the landscape of subspecialty training, or maybe you're even thinking about a career change, this episode is for you. So we're diving deep into fellowships, what they are, why they matter, and what you absolutely need to know before applying. Because fellowships can be a game changer, really allowing you to refine your skills, specialize in a particular area of urology, and really open doors to unique career opportunities. But the process of choosing the right fellowship, navigating applications, and making yourself a competitive candidate, well, sometimes that can feel pretty overwhelming. So that's exactly why we're here today. Today, I have the privilege of speaking with two esteemed fellowship and program directors who've been on both sides of this journey, mentoring fellows and really shaping the future of urologic subspecialties. Jay is the chair of the Department of Urology at Temple University Hospital and the fellowship director for his GERS Reconstructive and Prosthetic Urology Fellowship. He's also the chair of the GURS Fellowship Committee. And Sevann is the Associate Program Director of the Residency Program and Co-Director of the Mayo Clinic Urology Fellowship. She's also our Fellowship Committee Chair for the Sexual Medicine Society of North America. So we're going to break down the ABCs of fellowships, everything from how to choose the right program to the application process, your interviews, and really what directors are really looking for in a candidate. By the end of this episode, you're going to have a clear roadmap on how to approach this next phase of your training, whether you're considering sexual medicine, oncology, reconstructive urology, or another subspecialty. So let's jump in and get ready to learn from some of the best in our field. Jay, how is fellowship really different than from residency? And how do the roles of a chief resident and a fellow really differ?
Yeah, that's a good question, Helen. I would say, again, thanks for having me. I know I speak for myself, certainly, and Sevann. I think we're excited to get started. I would say to your question, I think fellowship is largely a little different than residency, right? Residency, I like to joke around that when you're an intern, you're trying to learn where all the bathrooms are and you're trying to figure out how the hospital works. And, as a chief resident, you're really trying to put finishing touches on being an independent practicing urologist. That really should be the goal of residency, is to get you from A to Z, where you're able to manage general urologic conditions safely in your community or in an academic setting. Fellowship, I think, is a little bit of a different nuanced take in a subspecialty of interest or one that you're interested in, where you would basically sort of take a period of time to dedicate your training to solely that field and solely sort of advancing yourself to the next step. And you would then figure out, as you sort of look at fellowship, if you think that's at a private practice setting, in a community setting, at an academic setting, a combination of those things in a multi-specialty group. All of those things could really apply for any type of fellowship experience. And it's your opportunity as a fellow to really immerse yourself in a subspecialty, which is a little different than residency, right? Where you're going from learning where all the bathrooms are to then, really mastering, the practice of general urology.
I'd agree with those comments. Also, the bathroom comments. I feel like that hits close to home. But definitely the fellowship part, the thing I enjoy the most about training the fellows is they truly like take ownership for our service, because this is like who they want to be and what they want to do. And it's very much like a true mentorship model, which at Mayo Clinic we do have for the residents as well. And they do kind of stay assigned to a single faculty member for an 8 to 9 week period of time. So we get some semblance of that, but it's different with the fellows, right? Like they really are your shadow. Everywhere you go, they want to see everything you do, even the things that seem mundane and uninteresting. They say, yeah, I want to see how you manage that postoperatively. And what do you do when the patient calls in with this? And how do you manage all these inbox messages from the patients? And so I think it's a very different mindset. And I remember being a fellow and feeling like almost afraid, like if I don't absorb all this information before I leave, how am I going to run this practice on my own, when I get out into the real world? So it is very different. It is finding that niche that you love, that you want to spend the rest of your career working in, and then trying to fine tune as many of those skills as you can before you're out in the real world.
Both of those are like such true ringing bell comments. And especially how they really take ownership, because as a fellow, it's like you're excited to stay late for that crazy complex case that came in the OR, versus when you're a resident and you are so tired and that case comes in at midnight, you're like, oh, so good. So
to take it one step further, if you're not excited to stay late for that case, or if you're not excited at the possibility of immersing yourself more in something, then probably fellowship isn't something that you should strongly be considering, is at least what I would say. I don't know if Sevann agrees or disagrees with that.
Yeah, no, I think that's fair. I mean, the fellow's the one that comes in on a weekend for a take back of whatever, case happened during the week, because they want to see it through. They want to see like the before, the after, and all the in between. So I think if that's not your mindset in that specific field, then maybe that's not for you, and I think that's something to think about.
these are such great things. So if someone's decided, like for me, it was sexual medicine and fertility that I was so passionate about, when's really the right time for an applicant to start building their application and really starting to network so that they can be a competitive applicant? What really opportunities are there out there so that they can really stand out as a fellowship applicant?
Yeah, I would say it's never too early, right? Like if you know you have an interest in any field, it's never too early to start exploring, and networking will take you really far. How you do that in 2025, I think, is very different than maybe it was even just 5 to 10 years ago. Some of that networking is through social media, right? You see people who have similar interests, and I think that's an excellent way to get your feet kind of wet. And then meetings, I can't understate like enough. Like the meetings are really critical to get to those subspecialty meetings, present your data, get as many like handshakes and phone numbers and names and whoever can introduce you when you go to the meeting, and let people know you're interested. Even if you're 3 years out from applying, you may change your mind in 3 years, but if you don't, then that person met you 3 years ago and they've met you every year since, and like you will be the first name kind of on their mind when it comes to selecting a fellow.
Yeah, I 100% agree with that. I think the sooner you think you might be interested in something, then expressing an interest in that and trying to, let's say, build your portfolio is probably in your best interest. And so some people might hear this then and think, oh boy, well, I'm too late. I don't want to be too late. And what does being late mean? And I don't know that there's a hard, fast rule in what late is. I would say that, ultimately, it's based on the timing of where you want to be and what you want to do. Ultimately, it's a buyer's market for fellowships, I believe. I believe that there are more fellowship positions just generally than there are people. Now, if you want a specific fellowship at a specific program, well, I think that's a little different. I think then, you're looking to be bought, and it's not necessarily a buyer's market. And so I think, urology is a great field. You have various people, I think, when you're going through training or when you are in practice already and you might want to consider doing subspecialty training. And in the end, we all chose urology largely because of the people who inspired us along the way. And fellowship is no different in that you ultimately sort of gravitate to certain types of fields because of what probably has inspired you along the way too. And if you feel that, that's something that comes to you early, then start building your portfolio. If it comes to you late, then also build your portfolio.
I love that. I feel like that's a takeaway, right? Build your portfolio. And I think how you do that, it can be variable depending on the fellowship. And we may get into that later, but don't be overwhelmed by the idea that you have to do all the things and be in all the places at the same time, right? Some fellowships are going to be very research heavy, and that's the expectation coming in. And that will get the eye of the program directors for those specific fellowships, but not all of them, right? Like some of us are just looking for somebody who's going to work really hard, who loves this field, who's going to be committed, devoted, and who's going to be an excellent like team player and member of the team. So, and there are many ways you can do that. Get involved in committees and different like subspecialty societies.
That's so true. My interest was early. And so I had met some mentors of mine when I was a fourth year med student. Like I met Trinity Vivalacqua, I met Bud Burnett, I met John Mulhall. And so I started going to those meetings early so that even throughout residency, when, there were a few times that I wasn't sure, am I going to do recon? Am I going to do sex med? Is it going to be infertility? What mixture of it? It was really helpful because you already had these mentors and people that you had met. So, with that in mind, like let's say someone's decided what they want to do now and they've started the journey to increase their portfolio, is it ever really like necessary? Does someone ever have to do a fellowship? Like what are the pros and cons of doing a fellowship?
Well, I think one, fellowship is not necessary. What are the pros and cons? I would say that some of that's individualized to the person, but in general, the pros of doing a fellowship would be that you get to immerse yourself in a certain field that you're passionate about, or you're hoping to develop additional passion towards. Two, it gives you some level of marketability in terms of future job placement. If you're trying to look to get a job at a competitive environment or with a specific group that you think needs that type of a position, then you sort of expanded your reach within that group or externally elsewhere if that's something that sort of interests you. Another pro I would say is again, relationships. You build more relationships with certain people and certain programs as you train in them and as you immerse yourself in that field. And so that may carry different types of degrees of weight to it. Another pro would be if you're interested in research, then those areas help build your portfolio in research as you start, perhaps a research career or an academic career, if that's something that you're thinking about or interested towards. Some cons, I would say, and that's not an exhaustive list, but I think that's maybe a beginning list would be that. I think as for some cons, I would say that one is that, becoming a fellow is a money-losing proposition financially. Generally, when you look towards doing a fellowship, it's those pros that I just listed out, or why people should do it or consider doing it at the very least. But then, if you were to think about entering the job market, it's no secret that entering the job market will give you more money and a financial reward sooner than perhaps doing a fellowship. So that I think is a con. I think another con would be that if you're interested in various other aspects of urology, then you might, for a certain example, pigeonhole yourself. I'll give you an example. I'm now a reconstructive urologist. I was very much interested. I loved kidney surgery. I loved doing partial nephrectomies, and I loved doing cancer surgeries when I was a resident. Okay, well, I'm a reconstructive urologist. I'm not going to be in the type of career where I'm going to be able to do generally reconstructive urology and, major cancer surgery. At least in the fields that we're in today and in the markets that we practice today, that's less and less likely. I think if you're in more of a rural market, perhaps that's more and more possible. But I think for you to bank on that, I think would be difficult. So I would say that that's a little bit of a con, and that you're unable to practice perhaps in all areas of urology that might interest you, perhaps based on the specialty that you choose to do a fellowship in. I don't know, Sevann, what other cons can you think of?
I mean, I think those are some great points. I think one is the personal sacrifice, right, that it takes to add that year or 3, depending on what the fellowship you're looking at is. That means a relocation, right? You kind of put off your life plans for another couple of years where you're going to end up. It can affect some of your relationships depending on who you're bringing along or who you're not bringing along with you, and family life, which we may get to later as well. So I think those are definite considerations. For me, like for fellows to see, what are their motivations for doing a fellowship? The one that gets me the most excited is when they talk about wanting that like extra depth of surgical experience to manage complex cases, right? Because that's something as fellowship directors we can deliver on. We want to make sure you're going to get that experience so that you can do those cases in practice if that's what you want. And for many people, that gives them, personal sense of fulfillment, which is great and very rewarding, like in your career. But I agree, it does sometimes gives you more job flexibility in terms of what you want to do, and sometimes gives you less, right? Even if you're going into private practice and you want to do kidney surgery and reconstructive surgery, and they say, hey, our need is reconstructive surgery, it's going to be difficult to argue that you also want to do oncology when they have 3 other fellowship trained people in that subspecialty, right? And so I think that's a real consideration as well, but that very much depends on the market you're in.
Yeah, absolutely.
Great points. I think a lot of times the fellowship, again, kind of contrary to that con of how it pigeonholes you, is sometimes that's a good thing, right? Sometimes there's certain patients you don't want to see, or you're joining a big group and you want to see kind of a more of a subset of patients. So I know, like I love doing men's health and infertility, and so I love that that's really my patients. I almost never see, BP. I don't see BPH. I don't see, stones anymore or any of that except when I'm on call. So it's kind of nice too for those reasons. So, if someone's looking at fellowships now, and, there's a lot of different ones. I think we have roughly 7 or 8 different fellowships in urology now. What is really the difference when someone's looking between your ACGME accredited ones versus something that's not ACGME accredited? Or even like for our sex med match, there's part of the match that's in the AUA andrology match, and then there's outside of the match, or maybe the SMSMA match. What are the differences between those two for people that are interested?
From my understanding is that we really only have 2 ACGME accredited fellowships, right? Which is the urogynecology and reconstructive pelvic surgery and pediatric surgery or pediatric urology. So beyond that, even oncology, which I think people are always surprised to hear, is technically not ACGME accredited. That being said, some fellowships and fellowship application processes are run tighter than others. And I think oncology probably leaning on the tighter and leaner side versus the SMSNA and the sexual medicine fellowships tend to run a little bit more fast and loose, hence why some are participating in a match and others are not. So it has a little bit become the Wild West. And speaking to Jay's point that you really is a buyer's market, because I remember when we were applying, Helen, I mean, there were a handful of fellowship programs. There was like 10, if that, maybe a few more than that. And now we have like almost 35 men's health, like sexual medicine and fertility fellowships, right? And that is in like such a short period of time. What about the GERS world, Jay?
Same thing. I mean, the GURS, when I was applying and interviewing, had around 8 or so fellowships. And now in North America, there are 30. And there are additional fellowships that are global in nature. And I would actually answer your question slightly differently too, Helen, to say that ACGME fellowships like pediatrics and the new ERPS field, formerly known as FPMRS, those fields are sort of managed educationally. The educational programming is managed by the ACGME, just as how the ACGME manages residency training in the United States today. Whereas in the other fields, the ones, infertility, sexual medicine, reconstructive urology, oncology, robotics, endourology, those fields are all managed by societies and societies alone. So societies decide whether they're going to do the match, whether they're not going to do the match, or a hybrid, like the Sexual Medicine Society fellowships, where some do the match and others don't. In the GURS, if you're a GURS program, you have to participate in the match. That is a stipulation of being a GURS program. And in the SUO, I think it's a stipulation that you need to participate in the match. Now, there are certain programs or there are certain fellowships that are not recognized by a given society, yet do oncology or do reconstruction, for example. So you might have a fellowship that is a reconstructive fellowship that is not necessarily managed by the Society of GU Reconstructive Surgeons, or similarly, an oncology fellowship that's not necessarily, verified by the Society of Urologic Oncology. And what that really means is that, those fellowships are not held to necessarily a societal standard. That's not saying that that's good or bad, That just means that whoever chooses to train at those types of programs truly rely on that program and that program alone to manage their education and their sort of, educational well-being is what I should say. Whereas, otherwise, the societies take some ownership in making sure that the candidates that are within that program or that are applying to be in that program follow some sense of order and decorum in how they're trained. And probably the highest sense of order and decorum necessarily comes from the ACGME, but the ACGME doesn't adjudicate matches or match lists or anything like that. And they don't do that for residency either. All they're supposed to do is manage the educational programming and ensure that people follow, for example, duty hours, educational objectives, and case logs. And in this case, I would say societies do versions of that based on the specialty that you're interested in.
I think there's so many different fellowships. And like you mentioned, who's going to help kind of regulate and making sure that you find that right fit? Is it going to be, especially if you're in a fellowship that works one-on-one with a mentor like mine is, versus one where you're going to work with different faculty? So how can applicants really kind of figure out what best fellowship for them? And how can they learn more about the different fellowship programs and really find out kind of, what's the culture of that fellowship? Because as you mentioned, different people are going to mesh better with different people. They're going to have different personalities. How do you really figure that out as a fellow when you're looking for a program?
Yeah, you can't emphasize enough that you have to speak to current and former fellows, right? Like, who will know the culture and the fit of a program better than the fellows? The residents are also, I think, a helpful group that you can go to for insight, especially if they're colleagues that you know from medical school or from kind of your social and academic interactions. I think they're a great resource as well. And then, Helen, you mentioned mentors, but mentors are also a great asset to give you a little insight into the field, into who does what exactly, and what is that fellowship really known for? Is that what you want to be known for in the future? Does that fit with your goals? And then your program director, right, in your current residency program should also be a great asset because they've spoken to residents from your program that have graduated and moved on to fellowships. And what has their experience been? Sometimes it's not all good, and it's helpful to have some of that insight when it comes to selecting a program.
Yeah, and to add to that, I agree with all of what Sevann said. And listen, what to summarize it, it's based on what's the word on the street, right? And everyone's looking for the word on the street, and the word on the street is some built locally from wherever you're coming from, and some it's built sort of externally from where you want to be or you think you may want to be. And ultimately, though, you have to sort of get numerous sources of information and try to compile what you think makes sense. The goal of fellowship is what we talked about earlier, right? It's to try to drive a life's passion that might exceed simply, maybe a career in general urology. And if you have a life's passion to doing that, then, it requires some level of investigation. And what Sevann described, I think, sort of summarizes that level of investigation.
Sevann, we also, with the SMSMA, you're chair of the new committee that really started something, because when I looked for sexual medicine, I just had to go by all the things you mentioned, and I just had to go interview and go see the program. But now we have a really great resource, at least for sexual medicine or some recon/andrology fellowships. Can you talk a little bit about the kind of new SMSMA's fellowship as well?
Yeah, I'm happy to. That's been like a labor of love for us, is how do we increase the transparency to applicants as to what each program really is all about beyond like the word on the street and talking to people, kind of boots on the ground. So one way we've done that is case logs, which we've asked programs like, would you allow us to post your case logs online, right? Like that's not an easy ask. So thanks a lot to all the program directors who have willfully kind of given us their numbers to post. But that tells the best story as to like, what are you going to be doing for that year of fellowship, year or two of fellowship that you're going to commit to. And so that's one way that we've tried to help candidates better understand what each fellowship program is about. We also recognize that it's challenging that not all the programs participate within the match, which means there's not like a hard start and stop date for application season. And so for those programs who aren't part of the match and have a rolling application basis, this year we've instituted having like a little kind of highlighted underneath each program which years they're recruiting for, so that you know, like, this might not be a program I want to waste too much time with because they've already filled their 25 to 26 and 26 to 27 slots, but they are looking for 27 to 28. So again, trying to make it more visible for the candidates as to like which years are these programs available, and then what am I going to be doing for that year fellowship. And then in addition, on each program's individual site, we have former fellows and where they are now and what they're doing in practice. So I think that's like at least the basic information you want to walk away from.
I think that's so helpful too. I always look when I was applying, I was looking like, where did everyone go? And I would see when I would be at meetings, like which fellows still hang out with their fellowship directors, like which ones seem like they have a good relationship and like really a family, because I know mentorship was really, really important to me. I think that kind of goes along too with like, so as you as a fellowship director, what are you looking for in an applicant, and what qualities are really going to make an excellent fellow? I think I'm the newest fellowship director in this whole group here, having just started my 2 years ago. And it was a learning process, for me to kind of figure out what do you really need to look for, because sometimes you can really love someone's personality and get along really well, but maybe it's not a good fit for the fellowship or the teaching that you're wanting to do. So like, what are you guys specifically looking for in an applicant? And I know that both of you is recon and andrology, but this really applies to, I think, almost all fellowships, that there's certain qualities and set characteristics that are really going to set someone up for success. So what is it specifically that you guys are looking for, and what really makes that like excellent, top-notch, outstanding fellow for you?
Yeah, so I think there are probably several things that are universal, like you said. And I would say that, speaking on that universal theme, I think there's a very small proportion, but not an insignificant proportion of people, and it gets back to reasons to do a fellowship. I think there are a proportion of people that might consider doing a fellowship to see if they're interested in a certain field. So I don't know if I like sexual medicine, or I don't know if I like infertility, or we don't really do any urethroplasty. So I think I want to do a fellowship to learn urethroplasty, I think. So the fact that someone may perhaps not have someone in their program that does infertility or urethroplasty, or maybe the cancer volume is lower, that's okay. But I think the concept that you would do a fellowship to learn if you actually want to do that field is less okay. So I think if as a fellowship director, I'm always a little bit wary of people who not necessarily come from a program that doesn't do reconstruction, for example. I'm not wary of that. I'm more wary of someone who perhaps isn't sure that they actually want to do reconstruction, and they're using a fellowship year to figure that out. And I would actually, hopefully, a take-home point of this podcast would be for people to dispel themselves of the notion that that's acceptable for themselves even. I don't think you're doing yourself a favor to spend a year or 3 trying to understand for yourself if a fellowship program is right for you. Now, another, I think, universal sort of quality people look for, and this is similar to maybe residency, but more so as in fellowship, is at the end of the day, is this someone that I would want to spend my day with? That's probably the most important thing, is at the end of the day, does this person meet my own test for can I spend a late night with them in the operating room or a late clinic day with them? For us, we have, several people that contribute to the fellowship experience, as I'm sure, as I know is the case with Sevann as well. And I think that's what I would call a group decision. And if ultimately there's, it's not just me, and if there's someone else in our team that sort of meets a candidate and is like, wow, I just don't think that I could spend my day with that person. You could have a great portfolio, like I talked about, but your portfolio has a limit to it, and it's that. And, ultimately that's a big one. And that speaks to fit, what I just said. Do you fit? And you may think you fit, but if the fellowship program doesn't think you fit reciprocally, well, then I have news for you. You don't fit. And that's just how that works. And so I would say that's a piece. And then finally, I think, there are different programs look for different things, research being one. If you're a more academically sort of, oriented program, you might weight that more. Other programs might like the personal nature of, do they know someone in your residency, and what does that person think of you? So you as a resident might not have a great relationship with a certain attending, but if that attending has a good relationship with a certain program, it doesn't matter what your portfolio says. The die is cast, is what I would say. And so I would say that, portfolio, yeah, for certain programs that matters. Who your quote unquote letter writers are may matter, but also who aren't your letter writers, but if they are known to that program, well, hey, that matters too. And that's just the world you're entering into. Listen, I went into urology, I said, because of some of the people that I met along the way that inspired me. But I also did like the fact that urology was a small, close-knit field. And well, this is one where that could really help you, or really, let's say less help you, as a fellowship candidate.
That's so important. I think one of the best advices I got too was, when you're interviewing someone, if you're looking at their letters of rec, take that from someone that you really know. Like, it's important to get a letter of rec from someone that you actually know and you trust their judgment and you trust their value, versus someone maybe you don't happen to know very well that's telling you someone's an amazing candidate. So I think there's so much of that too. Sevann, what do you think? Anything else to add here too?
Yeah, I think that was great insight, Jane. Also, like, when you're a resident, be on your best behavior at all times, unless you're sure you want to practice outside of the United States, because otherwise, like, not just finding a fellowship, but finding a job later also becomes very important in terms of who's going to be building you up and who's going to be giving them the inside scoop into what you're really like to work with. So I think that's great advice, in addition to what I would call the vibe check, right? The vibe check has to be good with everyone who's going to be training that individual in the program. And yeah, we need to, like, unanimously agree this is who we want. And then in addition to that, like, I like having somebody who's highly motivated to learn, right? Because we went back to, like, this is the person that takes ownership for the service, that's going to be there on the weekend and in the evenings and all those things. But they need to be highly motivated to want to do that. I don't want to be dragging them to those, events and cases. So they need to be motivated, and strong baseline surgical skills. It doesn't have to be in what we're actually training them, but we need somebody who comes in, like, with the basics down, right? Like, we don't have time. We just don't have the time to kind of go back to basics for those people who may not be there. And then in our program, like, I want somebody who's a leader, because that individual really kind of sets the tone for the other trainees that rotate through our service, right? Our residents and the interns and the med students who come through. So I need somebody who can, like, take the lead and run the service, like, on my behalf when I'm not there, or even when I'm there. Like, I don't take that slight at all if they, like, take full ownership and start calling the shots. I'm going to be, like, in the back corner making sure I agree with those calls, but I'm happy to, like, step back so that they can, like, step forward as a leader. And then somebody who's very emotionally intelligent, right, and can, like, read the room, and when it is appropriate time to speak up and make a suggestion, and when is the best time to stay quiet, and someone who has those, like, interpersonal skills. And so that it's not like a bull in a china shop, that we bring this fellow in to our program and then my chair is, like, complaining that that individual can't get along with people and we have nothing but complaints, right? So we also want someone that's a team player and, like, can blend in well with the whole team and like everything else that operates around us.
Yeah, I mean, just to add one final thing to this about letters, and specifically about letters of support, I would say is if someone writes me a letter of support, and this is just my perspective, maybe Sevann has slightly a different perspective, but if someone writes me a letter of support that I know, let's say Helen, for example, I could also just text Helen and be like, hey, I saw that letter, thumbs up, thumbs down. And sometimes people write a very strong letter of support because that's what they feel compelled to do, because they want to support their trainee, but they also know me. And they'll be able to say, if I know the letter writer, yeah, I'm not sure they fit that well with you, but they might not put that in with that letter. And so ultimately, again, it's the personal connections that you have with people, that fellowships. And that's why these are fellowship programs, right? I mean, fellowship programs have established themselves generally within their field. So generally, they're known. People are known. And so, the letters only go a certain distance, is what I would say. And for someone that's looking at a fellowship.
I would see that ad, and I'd be curious to see what Jay has to say about this. But like when the way I feel about our fellows is almost like they're our children. Like they are a reflection of me when they're out and about in like the urology community and in the department. And so when they have a negative interaction with someone, like it hurts me to hear that because I feel like it's a reflection on like what we thought about that individual and our decision kind of making process and our judgment. And so again, like cannot stress enough that like personal nature, like the relationships with people, like please be really careful and mindful of that because I feel like it's a reflection of me even after they've left our fellowship program and they're out in the world. Like I only want to hear positive things about that individual because I feel like it reflects back on us as a program.
I 1000% agree with that.
I could not agree more either. It really is. It's a true reflection of you, your training, because they're your babies. They're your little kids that you want to see go out into the world and excel and change the world for a wonderful way. That kind of brings me to the point, well, what happens when you actually find a fellow where maybe you guys don't click or the fellow gets into a program and realizes, oh my gosh, wow, we're really not meshing well or we're not working out very well or this program feels malignant to me, or maybe even the program director is like, wow, I really liked meeting this fellow. I thought they were so great. Their personality seemed wonderful, but they're lacking professionalism. They're not getting notes in on time. They don't seem like they're prepared for cases or that they're eager to learn. What do you do when you're in a situation like that?
Yes, I'm speechless. No, I I think like it's a two-way street, right? So it takes a lot of communication, and I think there are definitely some age differences and things over the years. I think we've come to realize like we need to be more explicit in what we ask individuals to do and how they do it. And when you give them those explicit instructions and then they fail you, that's one thing. But I think you have to give them a chance first. So like and again, depending on how long your fellowship is, if it's a year, like you got to do that really quickly into that first year to have that discussion. And then on the fellows end of things, like you do not want that relationship to end poorly because of all the reasons that Jay gave us in some of the other questions we responded to, because like they will never forget that, right? It's like an elephant never forgets. So they will never forget that. So you want to like try and fix that relationship no matter what, even if it is not your dream relationship. It is 1 year, it is 2, maybe 3 years. Like you can survive anything. You've survived residency, like you can survive this, right? So I think you want to put the time and effort unless it is like absolutely beyond repair and malignant and like you cannot solve it any other way.
Yeah, I think the best relationships can be saved with transparency. And, if that's either on the onus, we can look at this, that's on the onus of the fellowship director. I think the best way to look at it is that both parties share in that equally. And the way to perhaps do that is to try to be as transparent as possible. If you're the fellowship director and you feel as though, let's say, the fellow isn't doing what their responsibilities should be, then that, it's incumbent on the fellowship director to have a transparent conversation about that, as a professional. Reciprocally, if the same is felt by the fellowship attendee or the fellow, that their fellowship director hasn't, necessarily lifted their weight, or there's faculty issues, or there's program issues, well, then that needs to be raised. And this sum comes to ACGME versus non-ACGME. If there are grave concerns, that's where an ACGME can help manage that. However, I would say that, and this is what I would editorialize for residency programs as well, ideally, grave concerns are managed in-house first before it becomes an external issue. And in ACGME fellowships, there is an external body, but you're less in control of what that external body may choose to do or not do if there's a concern raised. So again, if it's ACGME or non-ACGME, I would say the best way to sort of manage those things are to have transparent and open conversations with the leadership of that program.
That's really great for everyone that's listening to this. Urology is a small world. You got this. Make it work. Try to find that right fit. There's a lot of fields, I think, in urology that have been traditionally male-dominated, like oncology and even andrology or sex medicine for a long time. Can you guys both talk kind of about the success of women who've done either fellowships with you guys or just done fellowships in these fields and their successes?
I think that's 100% that, urology. I remember when I was going through residency, it was less than 10%, I feel like, of urology residents were women. Now, I think that number there's trying to make progress. I think we're all trying to make progress in what that looks like. I think ultimately, fellowships are also trying to catch up to this, no question. Reconstruction was a field that historically was very male dominated. I can speak to my own experience that we've had, female fellow before, and that's, I think, something that needs to continue to happen throughout fellowship training throughout this country. That's point one. Point two, I would say is the fields themselves are making huge strides at trying to incorporate more and more, I would say, gender balance in how both men and women consider their fields. I don't think any field within urology has made an ordinance or decree or even, a backdoor decree that this should continue to be male dominated in any sort of sense. I think fields need to open themselves more towards, welcoming women to feel as though they want to train there. GURS, for example, has a women in GURS subsection that Lindsay Hampson out of UCSF deserves huge credit for in trying to lift and has successfully lifted. I think those types of initiatives throughout societies, both societies as well as within the AUA, help, I think, promote subspecialty training for all, people, both men and women throughout urology.
I think that's a great example. And I think what we're getting to is there's like a critical mass, right, necessary before you see a shift in any kind of group. And I think we're getting there for a lot of these fellowship areas. I specifically chose men's health because I knew I would be in the minority. And I only saw that as a positive. Some people, I guess, may see it as a negative, but it helps you stand out. So also coming into a field, think of it that way. Like you will stand out for better or worse. They will need a female on a panel somewhere, and that will be you. And that's okay. If that's your first time getting on that panel, I'm okay with that, right? So I think you have to kind of look at it glass half full where you can, and then relying on those mentors, right? And they don't have to be female mentors, right? Some of the best mentors may not be same gender, and they can give you a lot of insight into like what is success in this field? How do you get there? What do you want out of your career? So I think relying on those mentors can be very helpful. So I think we're in a great place in urology. I think women are doing incredible things, and not just because they're women, but because they're urologists and they're surgeons. And then, I mean, the number of female like trainees we have coming in, right, of residents as well, is like really inspiring. We're almost at 50% with our Mayo cohort, and we have 5 residents a year, now 6 residents a year. So, I mean, it's truly phenomenal. And it doesn't matter what those women go on to do, but if they want to be in a field, I don't think they should be concerned or worried that that may not be for them and they may not fit in with that group, right? It's all about you will have to find maybe the right fit, and not every program may be the right fit for you. But I think sky's the limit.
And I would add that, I still want to believe, and I think that I'm right, that ultimately where fellowships are looking to future trainees is to look towards a trainee that's going to work hard, develop a passion, cultivate that passion, and represent that program well. Those are the qualities that I think unify all fellowships. And I think we heard what Sevann looks for. You've heard some of how we look at fellows, and nowhere there is sort of there a claim or a thought that, this needs to be balanced towards a certain gender over another. Ultimately, to Sevann's point, I actually totally agree with the glass half full. I went into reconstruction because when I was going through, training, there weren't many people that had an academic career in reconstructive urology, period. And so I figured I could go into reconstruction because I felt the academic bar was somewhat lower than it was in perhaps, let's say, oncology. And I chose reconstruction, and, the rest is history. And I think it, to a certain degree, helped me in my academic growth. But very similarly, I think that the point that she made just a few seconds ago, I think is spot on in terms of how to pursue it, if you're considering a field as a female. I think that's correct.
I feel the same way as you, Sevann. Like, I love being a female in sexual medicine and being someone who takes care of men's health. It's awesome. I think one of the most common questions I always get asked too is like, were there any specific challenges that you as a female or women in general face when you're, in fellowship or when making decisions about fellowship that men don't have to think about? Or was it harder as a female? And, I think that usually boils down to when people start talking about family planning. I mentioned this on another podcast, but I had a kid in residency, I had a kid in fellowship, and I had my third child when I was in attending. And, I don't think any one of them was necessarily easier or harder than the other. It's nicer as an attending because you control your schedule more, obviously. But, I think it doesn't matter. And people shouldn't think that, you have to put family planning on hold if you do a fellowship. It can be a little challenging navigating if you're in like a 1-year fellowship. My fellowship was a 2-year fellowship, but if you're in a 1-year fellowship, there can be some challenges that you have to navigate and go through that. But I was very lucky in my fellowship that, when I came back, I think it took 6 weeks off after my second child. And, it was important to me to breastfeed. And so, pumping at work and how do you navigate that with seeing the patient load? And it always worked out. Like my fellowship director, I never felt pressured. I never felt like I had to ask permission. I always, when I needed to go take a break, we had an office space, a special room in our office that I could go into and I could pump and then I could come back and just start seeing patients. And nowadays there's even those like wearables now that I think I found out about. That's my third kid, unfortunately, but that you can make those things really easy. And there's lots of tips and tricks on how to still do that and still show up just like attendings do at work that have babies too. And I don't think that's something that needs to be necessarily put on hold or something that you feel like you can't do just to do a fellowship. Is there anything else that you can think of, specific challenges that maybe you want to talk about or address, either one of you, about women doing fellowships that are a little different and may not impact men?
I tell just trainees in general, you don't want to put your life on hold. You do to some degree, you have to. Certain things just can't happen simultaneously, but you can't put your life on hold forever, right? Because if you have very little good quality of life from your day to day, you will get burnt out very quickly, and then you will definitely not want to do a fellowship, or if you do, you're going to regret it, and you may miss out on a number of opportunities along the way. So I think you have to be thoughtful about when is the right time to do this or that, or get married or have that child, or whatever the case may be, or take care of a loved one, right? You have a older parent who needs help. This comes up not just for women, but for men as well. So we can't put our life on hold forever, but you want to be tactful. You want to be strategic in terms of what fellowship, either subspecialty wise or specific fellowship, may be most amenable to some of the things that are important to me that I'm going to plan to do in the next year or two. So I think you need to be thoughtful about that. And transparent to some degree, right, with your fellowship director, because you also don't want to come into a situation where maybe that environment is not very hospitable to what your personal goals are. And that may be kind of a source of frustration for the both of you. So I think, being transparent to some degree about what you want to do and what your goals are, and making sure that the fellowship you've chosen or the path you've chosen is going to allow that to happen.
Yeah, I 100% agree. I would say the part that was just mentioned about being transparent to your fellowship director, I think is important. I'll use my own personal story. I hope they don't mind me saying it. Crystal Chang was a recent fellow of mine. She's now an attending at Robert Wood Johnson. She was a fantastic fellow that I was lucky to have with me for our fellowship. And, months before her fellowship started, she reached out and basically told me that she was expecting during, her fellowship year. And I think that was fantastic. And, listen, I'm a dad too. And I have, now a 7 and 5-year-old. And I just remember the joy of having a kid. And no one should have to endure the fear or anxiety of having to explain why they're having a kid. And I hope that Crystal would never say that she felt that type of fear with us. And I don't think she did. But I also know that she was able to, 1, do a 1-year fellowship, 2, plan for it during the fellowship with me and with our team, and 3, have, I think, what was an outstanding experience. And I think the team here really appreciated all of her efforts pre-kid, and as her toggling sort of the struggle of being a mom too, which I think all of us recognize both in our own lives, and both, I think the female faculty, at our institution, but also even the men, so totally, I think, understood what that takes and what it is. And so, to Sevann's earlier point, though, I do agree, though, that having that type of a conversation as not necessarily a family planning conversation per se, but more a conversation about, what your goals or thoughts may be in terms of that might actually help you and your fellowship understand where you're headed and what you're thinking. And that's okay. You shouldn't have to explain it away. You shouldn't have to defend, your life decision. Programs that are willing to accept that life decision and embrace that life decision actually gives you a sense about what kind of program it is that you want to be at as well.
Agree. And on the flip side, right, like speaking of life decisions, it's not uncommon that you may take a fellowship position and then your fellowship director takes a new job somewhere else, right? That happens. That's just real life. So, or they get injured and they're out for a couple months, right? That happens as well. So, life happens. So, I don't think you have to be apologetic about trying to plan your life, right? And while it may seem like you could time it perfectly, you can't always control when you get pregnant and when you're going to deliver and how all of that works. So, I think you do your best to be transparent with your program director as much as you can.
You both hit it on the nail. It's going to allow you to get to know that person better, get to know the program better, and see if you're a great fit. Because if you're not being transparent and you don't disclose this, then you're missing out entirely and you may get into the wrong fit versus it gives you the opportunity to see how they respond, how you respond, and really help you feel better about it all. I couldn't agree more. It kind of brings me to my last question for the night. A lot of people, because of this, life happens, a medical or personal health injury or family emergency. What's really the impact for someone, that is going to have maybe a delayed graduation or a late start date from their residency? And how's that really going to impact matching their fellowship? Because, for example, it could be with family, like I mentioned, or personal health, but also some people start late due to military required training that either couldn't be completed during residency, and others who are just off cycle for numerous different reasons. How does that impact fellowship? And what would you guys suggest for those people?
I would say, I think it's a little bit of a theme of this podcast, perhaps, is being transparent only helps you. Not being transparent can only hurt you. And for example, if you know that you can't start a fellowship at the time of when the fellowship is supposed to start, again, the professionalism of the field that you're entering, I think, mandates that you share that transparently with the program that you plan to join. If you don't know that you can't start at a certain time because of some unknown issue or unknown commitment, I think that's very different. But I will say that, there are fellowships that I've been told of that hold people to a contractual commitment, especially if they feel as though they're not being reasoned with truthfully. I would sort of strongly urge people to, again, rise to the professionalism of the field and hope to have transparent conversations with your fellowship over what your needs may be in terms of starting later than anticipated. That's at least what I would hope people would do. And that doesn't mean that we would penalize them for starting later. But again, it allows us and every other fellowship to plan for the onboarding of their fellow, which I think is the respectful thing to do.
Yeah, I would agree with that. And wearing my associate program director hat as well, there's a lot of planning that goes into mapping out rotations for 25 to 30 individuals every year, as you would imagine, and where all the bodies are going to be and what rotations are available and what isn't, especially with kind of the model we have here with our mentorship model, kind of a one-on-one. I think the more information you can give them, the earlier. That's very helpful for those of us that are on the planning side of things. But also, if you're at a fellowship where there are multiple individuals you're working with, that probably affords you a little bit more flexibility, right, as to like where you can go and where you can be when you get back. And then depending on kind of what the requirements of your fellowship are in terms of case log numbers, keeping that in mind, right? So it's not just like holding you to the calendar date, but also we want to make sure you get all your cases in so that it doesn't reflect poorly on our fellowship as if we didn't provide you the like surgical experience that you need. So I think just keeping that in mind, I think most programs would be flexible, especially given, kind of extenuating circumstances.
This has been I think one of the best podcasts I've ever heard or had the honor to host. I think some of the take homes are just that it's really never too early to start building your portfolio and working towards getting your application great for fellowship. It is so important to find that right fit. Urology is such a small world. Don't do a fellowship to decide if you want to do something. And just be transparent. Being transparent is really going to be an honor to yourself and help you find the right program that's really going to help you grow and really specialize in the field that you love. And that should really be your reason for doing a fellowship. So thank you both so much to Jay and Sevann for being on our podcast tonight.
Thank you, Helen.
Thanks so much for having us. It was awesome.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, DM us at _BackTable Euro on Instagram, LinkedIn, or X. BackTable is hosted by myself, Ruchika Talwar,
Jose Silva,
and Suzette Sutherland.
Our audio team is led by Kieran Gannon, with support from
Aaron Bowles,
Gabe DeGrazio,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Chi Ding.
Administrative support provided by Judy Dela Cruz.
Thanks again for listening and see you next week.